I am
Hello, folks, and welcome.
Hello.
A wonderful audience. Thanks for coming. I have some announcements before I introduce Beth. Because of the space in here, the book sales, the book signing, and refreshments will be out in the library. I mean, most of you know how crowded it gets, and we'll try to do all that in here. So all those are out there. Since the library staff has turned over and the Friends officers have turned over, we're trying to gather a more comprehensive news release of people in the area who are interested in Friends activities. So a mailing list will come around. So if you are interested in future activities, of course, put your name, address to receive the Friends flyer in the winter, and then emails for newsletters and updates. Most of you already have seen in your seat. The next event of the Friends is a Barbara Kingsolver activity at the Martha Washington, November 17th. So I know a lot of you will be interested in attending that. And tickets are on sale on the library's website, but notice on the flyer, there are sort of some particular details to get to that. It's not just on the initial screen. So everybody certainly is encouraged to see that. I think Beth is gonna give a plug about the book. She's excited about it. She said it was the best book she'd ever read. So that's exciting. Okay, now to the main event. Beth Macy has been kind enough over the years to come visit with us on the publication, I think, of almost all of her books. And most of you know about Dope Sick and the TV program that came later. And after she completed that, Beth's husband, who's sitting over here, suggested that she should write about happy things this time, like food and gardening. While her mother, who had some mental issues, said that advised her about 8 times a day to write a love story instead. The follow-up to Dope Sick is, as you know, Raising Lazarus. And this is what Beth said about that. I'm not writing just about death. I'm mostly writing about helpers, as Mr. Rogers called them. I'm writing about people who are actually making a difference. It feels really good to give them a platform, a voice. And that's the essence of this book, is the positive things that are being done about the addiction crisis in the area. So welcome Beth Macy, who's going to tell us about her new book.
There's some chairs up here.
Wow, how nice, thank you.
Yeah. You could also sit by my cutie husband over there.
Oh.
Yeah. Yeah. Well, thank you all for having me. I know I tell this story every time I come to Abingdon, but the first time I came to Abingdon, I got to interview Lou Crabtree. Who knows Lou? Oh my God. And did she live on Valley?
Yeah.
Okay. And we did the interview on the front porch. She had just been named Poet Laureate of Virginia. And me and Stephanie Klein Davis, a photographer friend that Gene and I know, came up here and she said, I mean, my hair was still dark then, that's how young I was. She goes, "You girls are awful young to be so far away from home. Aren't you scared?" It was so sweet. And then her husband, he would answer the phone, whorehouse. Do y'all remember that? And then Lee Smith is the one that told me about her. Lee told me about how she like sauntered into her first writing workshop. I think it was here in Abingdon that Lee was teaching, and she had like just paper scraps coming out all over. And then she read the first line from her short story that Lee eventually helped get her first collection published, and it went, Old Reller had 13 miscarriages, and she named every one of them. And she was just such a deep person. She was telling me when I was interviewing her, I asked her what she was working on next, and she had just gotten a rejection letter for her second collection of stories. And I said, what'd you do? Because I sure have been rejected a lot in my career. I said, what'd you do? She said, I took all my clothes off and I went outside and I rolled in the snow. Amen, Lou Crabtree. I'm glad to be in her space. I also wanted to shout out the library because when I wrote my first two books and came up here, I was just getting started on Dope Sick, and a lot of people in this room helped me with sources. I left with just a list of phone numbers and people who were willing to introduce me to folks. It was so helpful. A lot of the lawyers that had worked on the case or earlier cases against Purdue kind of came out of the woodwork to help me. And special recognition to my friend Sarah Melton, who's in the front row, pharmacy professor, pharmacist. She was really the first expert I called. And she took me through the whole story, how it all went down, everything, and said, call this, do this, do this. And I just, my rule is just do what Sarah tells you to do. I am super excited about this book. I got to read an early copy. It is the most incredible piece of writing set against the backdrop of the opioid crisis. And with a main character, this kid, the first word of the novel is first, comma, I got myself borned. And this kid is so resilient. And the voice is so unusual that it reminds you of, the freshness of Huck Finn or Holden Caulfield. It's that good. I'm going to be in conversation with her on November 2nd through a bookstore in San Francisco, but it will be Zoomed, and it's called Book Passage, and it'll be at 4 Eastern Time on November 2nd. And if you wanted to look that up, the store is called Book Passage. I'm sure we'll be talking about the opioid crisis. I always start by saying, I'm sorry for your loss. I know there are people in the room that have lost people or have had people suffer because of the overdose crisis. I know there's hardly a family in Appalachia that hasn't been affected by it. When I first started talking about the crisis in 2018, when Dope Sick came out, I would say, I'm sorry for your loss. We lost 72,000 people last year, every one of them a tragedy, and a total undercount, by the way, because it never counts addiction adjacent things like suicide, HIV, hepatitis C. And it's not just those folks, it's the friends and family members. And now, 4 years later, I say, we lost a record, 108,000 people last year to overdose. Every one of them a loss. So Raising Lazarus is, if Dope Sick was about the problem and the origins and all the barriers, Raising Lazarus is really about solutions. But the big picture, as I see it, and it really hasn't changed that much since I first started reporting on what we then called the heroin crisis for the Roanoke Times in 2012. I was writing on a cell of a nascent cell of heroin users out of this wealthy suburb called Hidden Valley in Roanoke County. And It was before we really understood the connection between the OxyContin and heroin as a nation. But the big picture then and now is that the opioid overdose crisis, the addiction crisis, is festering and growing. It's taking advantage of long-standing fissures in American society, from a nation that sends jobs away, but did very little for the people left behind. Of a nation that doesn't offer universal health care, and of the fundamental philosophical difference between treating folks like a criminal and a moral failure versus treating them like a human being with a treatable medical condition. What we're doing isn't working. So I'll leave time at the end for questions too, but I'll talk a tiny bit about dosing. I probably won't talk about the show, but I'm happy to take questions about it. And I'm gonna start with one slide of spinach, one slide of numbers. I really like stories better than I like numbers, but these are the numbers that really made the hair stand up on the back of my neck. So I already said we lost 108,000 people last year. And when you tally up all the deaths since OxyContin came out in 1996, it's actually north of 1 million. A lot of times they'll say we've lost 500,000. They've been saying that for 8 years. And that number goes back to 2009. When you bring it up to date and you go back to 1996, which is when the crisis began with OxyContin, it's over 1 million. And we know that too is an undercount. The guy who does that study says that we are going to double to 2 million unless drastic measures are taken by just 2030. So 8 years is going to double. So we have more than 7 million people with opioid use disorder. And that's from data that came out in June. That's a 4 times count what was previously known. And we know addiction is a chronic relapsing disease. It takes 4 to 5 treatment episodes over an average of 8 years for a person with substance use disorder. Now that would include alcohol use disorder and other addiction disorders, to get just 1 year of sobriety. And for opioid use disorder, which is a category of substance use disorder, it takes 2 to 3 years longer than that because people tend to get so low in terms of their social capital. We have a treatment gap of 87%. That means only 13% of Americans with OUD managed to get care in the past year. If we were in school, that's an F. It's like an F minus. 5% got MOUD. That's medicines for opioid use disorder. You've heard most commonly described as MAT, medication assisted treatment, and that's buprenorphine, the brand name Suboxone, or methadone. And there's a lot of stigma against these medicines. Most treatment facilities don't allow them. When the CDC, the National Institutes of Drug Abuse, and the World Health Organization all believe they are the gold standard of care. 80% of people with OUD don't need inpatient care. That's a stat that really surprised me from American Society of Addiction Medicine, because we know families that have remortgaged the house and spent $30,000 to send somebody away for the treatment that is usually exactly the wrong kind of treatment that they need. When you're better off staying, getting counseling, social support, staying in your community, and getting on buprenorphine or methadone. And every dollar spent on treatment saves 12 or more on reduced criminal justice and healthcare costs, which is more important now than ever with the opioid litigation beginning to come down. So the first batch of dollars from the distributor settlement started to come down in June. And my fear, and the fear of many people that I respect a lot who have studied this, is that the money is going to go to the same old abstinence only, incarceration first models. And so we've got to get active about what's happening with this money. especially with the press in decline. We've got to, and I'll tell you some examples of people who are really bird dogging this money. But this is why I wrote the book now, why it came out at the time when the money is starting to come down. We know there are a lot of communities that really don't know what to do with it. And if it goes the way of the tobacco settlement, which remains the largest settlement in American history, it'll go to fill budget holes, shortfalls in state budgets, or build a golf course.
Yep.
All the things that aren't what science says is the best way. And we've got 108,000 people dying. So if you've read Dope Sick, you might remember that the second half of the book, the first third of the book is about OxyContin in the coal fields. And then I pick up the story with a young woman in Roanoke who I met through a friend of mine. She was in her mid-20s, she had a baby, and she had been in heroin addiction for about 4 years when I met her. She had initially been overprescribed opioids in an urgent care center for a simple case of bronchitis. 2 30-day prescriptions. One was for Tussie caps, which is for cough, and the other was hydrocodone for sore throat pain. And at the end of 30 days, she felt really terrible. She Googled her symptom. She said, "Holy crap, I think I'm addicted," and was able to score pills on the black market when the pills got hard to get, was then able to get and was taught how to crush, or was taught how to snort the heroin and then to shoot it up, just as she had done with the pills prior. She found out she was pregnant when she was in jail. She was in jail for stealing a plumbing implement from Lowe's, which she planned to take to pawn shop to get money to buy heroin. The reason the book is called Dope Sick is because every person I interviewed, that's what they called this excruciating fear of withdrawal, which is this, they all say it's like the worst flu times 100. It's diarrhea, nausea, restless leg, crushing anxiety and depression. And as somebody in Honecker, not too far from here, I believe, said, "Honey, at the end of your journey, you're not doing it to get high. You're just doing it so as not to be dope sick. And you're as angry as one hornet will ever be," she said. So when I first interviewed Tess, it was late 2015. She described all the barriers she had been through to get on treatment, evidence-based treatment. And it was just incredible. And she let me into her life, as did her mother. That's her mother, Pat, because they both wanted me to see how hard it was for her to get help. Now, Tess is the daughter of a surgeon and a hospital nurse. Family had a vacation home on Bald Head Island. Money does not protect you from this disease. It just doesn't. In some ways, it makes it worse because of the stigma and the shame, especially back in those years. And so Tess was constantly being denied access to treatment. When she tried to get on buprenorphine, the local outpatient center from Carilion had a 3-week waiting list. When she would go to the ER for an abscess or an overdose, they would fix whatever was ailing her, but never treat her substance use disorder. And she finally got in with a doctor in Blacksburg who charged her $500 the first week and $100 a week thereafter for her buprenorphine. She was doing pretty well on it. And then when she, like 2 months in, she tested positive for marijuana. And rather than increase her treatment, they kicked her out. Which led her back to heroin, which now has fentanyl in it, which is just super dangerous. So these two really stepped up their leadership. So I really wrote this book as a way, you could say the spirit of Tess is hanging over every page of this book. She was ultimately lost her life on Christmas Eve. She was murdered. Her body was found in a dumpster. She had been doing sex work and living homeless in the abandoned minivan of a pimp. and her mother got the call. It was, they didn't track her down, who she was, but she was naked, her body had been burned, and she'd been put in this dumpster on Christmas Eve. And her mother called me, and every detail was worse than the last. And we did a podcast called Finding Tess. It was an Audible original where we tried to retrace her final steps. And really, it's an indictment of the systems that abandoned her, including members of her own family. And ultimately, her predicament led to some real change in her hometown of Roanoke. And so I give these guys a lot of credit. They were really the first nonprofit buprenorphine providers in the Valley. They talked the emergency department. Y'all know what Carilion is, right? It's 5 hospitals, largest employer in Roanoke, it's got a medical school. They talked the emergency director and the administration into approaching addiction differently. So in 2017, when I interviewed the head of the ED, Dr. Burton, Dr. John Burton, he said, I said, so why don't you do ED, bupe in the ED when people come in for an overdose or an abscess? He said, well, that's not our purview. But he said, that's really treating a drug addiction with another drug. He was very cynical about it. He said, most people, he had kind of given up on him. He said, they're either going to end up in prison or dead. And we had a good interview. And a couple of years later, I called him back. It was 2019. And I said, Dr. Burton, I hear you're doing things differently. In 1 week, the week leading up to Christmas, he got all his docs waived. Doctors have to get a special waiver and a DEA number. They have to do 8 hours of training in order to prescribe buprenorphine. Now, do they have to have a special waiver to prescribe OxyContin? No. And there is a bill, and it's currently in the Senate. It's already passed the House. It's called the MAT Act, and it would take that waiver away, which I think would really increase access, get that 5% number up. Many doctors don't want to do buprenorphine because they don't want those people in their waiting room. So there's a lot of stigma around it. But I said, Dr. Burton, what happened? You could hear that his voice was so different. He goes, well, we read your book. And then we looked at the data and we said, how can we not be doing this? How could we not? How can we take a pledge to do no harm and know that we were part of the start of this? And I tell doctors this all the time, whether you took a free trip to Scottsdale, Arizona or Florida, like the Michael Keaton character does in Dope Sick, or not, you still participated in this. You ought to participate in the solution. And the first time I said that was from a bunch of Carilion doctors and med students, and it was crickets. And then 6 months later, Dr. Burton is doing it. He's doing it. And he's so happy. He's like turning mental cartwheels. And they've got a really high rate of, what's it called? People stay in the program. Thank you. Thank you, smart person. And, you know, he had like 37 people into their program, which they had to increase capacity in the first month. And he did say, it's like turning mental cartwheels. So now he is out and he is teaching other people how to do this in other emergency departments. So I said, the spirit of Tess hangs over this. What did Tess mean by urgent care for the addicted? Because that's what she said the first time. She goes, I got addicted to urgent care. What we need is urgent care for the addicted. And she didn't know what it was because she had never seen it. And I didn't know what it was because I had never seen it. Now, when I was working on Dope Sick, I like to call like people and I'll tell them what I learned from other people. And then I'll call them back a couple months later. And this young woman, so she grew up in Letcher County, Kentucky. In some of her first memories of her friends' parents overdosing at birthday parties. And her goal was to go away, to get educated and come back and help Appalachia. So she just got her PhD not too long ago, but when I first met her, she was working in rural Indiana in a little town called Batesville for a nonprofit hospital. And she had worked her way up to the head of mental health and addiction. Her name is Nikki King. And at the same time, the town took a vote. They said, what's our most pressing problem? Well, it's the overdose crisis, right? And so it's not far from Scott County where they had that huge HIV Opana outbreak a few years ago. And a local mom had overdosed at a Chuck E. Cheese with 2 of her kids. I mean, it was just like you could not pay attention to it anymore. So they had this big community gathering about, we're gonna fix the opioid crisis. And so Nikki, who was like 25 at the time, marches up to the judges and said, what are we doing for people who are coming out of jail? Because people who are coming out of jail are 40 times more likely to overdose and die because they're opioid naive when they come out. They go back to their former amount. They've had no treatment in jail usually. And then when they go back to their former amount, it now has fentanyl in it. And so it's really a vulnerable moment. So she said, we've got to work on that. And they said, oh, we're doing like an hour of counseling a week. And she said, we can do better. So she basically created an evidence-based program with the probation department and with the judges and with her rural hospital under the promise to her boss. We know rural hospitals are closing, a lot. And that I'll have this program be cost neutral in 6 months. I mean, and she's like, I can do it. I know you don't know how, and I don't know how yet, but I'll figure it out. And she had done so many things before that they trusted her. And so they wrap services around people. These are people who've been in and out of jail and prison their whole life. And in the first 18 months of this program, they had 0 overdose. 0. It was a small group, it was 30-some people, but that's unheard of. And what they did is they did intensive outpatient treatment, but at night, so you could work during the day. They helped you get a job. They got you signed up for Medicaid. They got you on buprenorphine unless you didn't want to get on it. They helped you get food. Almost everybody was food insecure. Their first meeting, they said, asked everybody what their goal. One said to own a second pair of pants. Another said to taste salmon for the first time. She said, and when we put the snack bowl out, it was like a herd of baby antelopes descended upon it. And so the only problem was 6 months into the program, Indianapolis called and said, hey, we can't reimburse you because you're not in a healthcare facility. And she said, are you kidding? The reason it works is because we're not in a healthcare facility. That we now know the probation officers and the judges, and we work together. And they see that these people aren't just moral failures and criminals. And they're starting to have success. And they're getting that tone of voice like Dr. Burton had. And so she cried in front of a bunch of middle-aged men, hospital administrators. And she said, y'all have no more rabbits to pull out of my sleeve. We're gonna close our program because we're not getting reimbursed from Medicaid. And somebody said, make her stop crying, make her stop. They said, oh, what if we put in this clinic down there? And she said, no, the reason it works is like, they let us, like when somebody relapses, they let us have input. And not everybody goes back to jail. We increase their treatment instead. So then out pops another rabbit, and she said, I know, what if I buy the courthouse? And so for $25 a year, they walled off half of the huge conference room they were already using, and they created a center of the hospital inside the courthouse. And they put up a door and a sign that says, Mary Margaret Health, Ripley County Court Services, Suite A, which they thought sounded a lot classier than room 1. And above the door, the head of probation, who had been this really tough on crime guy, put a sign up that said, make today amazing. And I'm saying this because 6 months prior to that, I dare say he didn't think any of these folks had arrived to an amazing day. But he started to see things going differently. He started to understand that what they were doing before wasn't working. So Virginia passed needle exchange, I think, somebody correct me wrong, I think it was 2018. Sarah, do you remember? Yeah. So when that happened, y'all have an incredible health department director in Lena Wisco. She retired recently, but her name was Dr. Sue Cantrell. Anybody, any Sue fans here? See, she's so great. They opened the first needle exchange in Virginia. And the cops didn't want to do it. They said, we're going to give them needles. And she totes out the data. People who visit needle exchanges are 5 times more likely to eventually enter treatment, and 3 times more likely than those who don't to eventually stop using drugs altogether. So it's this concept of most people who are using opioids don't want to stop using. And it's for a variety of reasons, a lot of which have to do with it being so stigmatized and the fear of dope sickness and all the barriers they've had trying to access care and being treated so poorly when they did try to access care. So this is a concept of, we're gonna have this little needle exchange. And the first one I went to, this was in Roanoke, Virginia, it was the second one. Sue Cantrell talked the law enforcement into signing off in WISE because she said everything else we've tried hasn't worked. Nothing else has worked. We've got to try this. The data supports this. So the first time I went into the one in Roanoke, it was 2 years later, by the way. It was still only the second one in the state to open. It was opened by this young man, Lawson, I'm blanking on his last name, couple. And it kind of reminded me of a preschool. There were like decorations up on the walls. There were couches. There were computers where you could apply for jobs. You could get signed up for Medicaid. There was food pantry, a clothes closet, inspirational sayings on the wall. And I got kind of verklempt because I thought, this is what Tess meant. A place where I could go, not be judged, treated with respect, even if I was still using drugs, and being brought into a system of care. And so this is a concept begun in the 80s during the HIV/AIDS crisis by, he's thought of to be the father of harm reduction, Dan Big. Any positive change as a person defines it for him or herself is our definition of recovery. And notice it doesn't say abstinence, no drug use. It says any positive change. It's this idea of trust and incremental change. And the first person that really explained this to me, I was in New York State, and he told me about how he had been a heroin user in the 90s and had gone to a needle exchange in New York City. And he went to the counter and they said, "Hi, can I help you?" And he said, "I'm hungry." And she gave me a sandwich. And one thing led to another. He eventually got into treatment. He has a master's degree. He runs a treatment center. He's here, he's alive because of that sandwich. So it's those other little steps, those little positive changes. So the harm reduction I most feature in the book is the Reverend Michelle Mathis. So she and her wife, Karen Lowe, run what's the nation's first queer, biracial, faith-based harm reduction organization out of Hickory, North Carolina. Say that 3 times fast. And she has a tattoo, Karen has a version of this tattoo, which is acta non verba, do shit, don't just talk about it. So in 2009, before it was legal in North Carolina, they started out as a food pantry, giving out food from the back of their pickup truck. And they quickly realized that about half of the folks that came were IV drug injectors. And then they quickly kind of pivoted, reached out to harm reduction groups elsewhere. And so then they noticed that if you take out half of the granola bars from a box of Nature's Valley granola, 10 needles fits in really well. And they would stick in their card and it said Olive Branch Ministry and the phone number. so that if a relative found it, they go, oh, how nice, they're going to church. And they put a piece of tape on it, so they could kind of keep track of which boxes they had doctored. And now they have 3 needle exchanges in the furniture belt of North Carolina, based out of Hickory. And they have mobile exchange run by a peer recovery specialist. Do we have any peers in the room? Okay, these are people in recovery who have gone through special training to help other people who are still in use. So that's Jessica Maloney on the right. When she first met Michelle, Michelle was doing a recovery class in jail, and Jess was in shackles. And she now runs all over the place, meeting people in parking lots and giving them needles. She gives them food. She brought the woman in the tent cat food. I was speaking in Gaston County a couple weeks ago, and I heard about the woman in the tent. And she said, oh, honey, she's been sober now for 5 months.
Wow.
It's 5 months. She was living in a tent with her cat. And the new book begins in a McDonald's parking lot next to a dumpster, as all good books. And this nurse practitioner named Tim Nolan, he works at a FQHC, which is a federal qualified health center, during the day in Morganton, North Carolina. And at night, he volunteers for Olive Branch. And, he started, he would meet people by appointment. I'll be at such and such truck stop Wednesday at 6. So if you want clean needles, come. And he quickly realized, because somebody said, I think I have hepatitis C. And he got her treated, the next week. He tested her the week after, he brought her treatment. Then she got cured. And she said to him, hey, I have a lot of friends that probably have this too. So he starts doing hepatitis C testing pizza parties in this woman's house. And he does all this at night, 2 or 3 nights a week. He goes into the forest of the poor, under bridges, in trailers, in people's houses. They're not all gatherings, he's visiting them. And this is what's called low threshold care, or low barrier. And when somebody's interested, he gets them on buprenorphine. So what he's doing at the beginning of the book, next to the dumpster, is he's meeting a new patient that has been sent to him by the needle exchange folks, Michelle, acting on Verba. And they've sent him here, and he's meeting a new patient named Sammy. And Sammy shows up late, he's high, he's got a broken face mask dangling from one ear, and he's crying. And he says, I'm gonna die if I don't get off the needle. And Tim says, well, let's get you better. And he says, tomorrow, I'm gonna call in a discount buprenorphine prescription to this one Walgreens that he's arranged with it through the FQHC where he works. But I want you to take away 2 things, and this is really the crux of Raising Lazarus. One is, you can get better. Most Americans think they can't get better. They've just written them off. Most people who use think they can't get better. So many barriers. So one, we gotta have hope, right? We gotta have hope. And 2 is, don't disappear. And that means that even if you get your bupe tomorrow and then you reuse, whether it's meth or something else, or opioids, 2 days later, still come back next week. I'm not gonna kick you out. And if you can't come to me, text me and I'll come to you. And by golly, that's what he does. And he has amazing results. This is him signing up a new patient who had just overdosed 2 days before. And then I've been down there many times, and he says, oh, you gotta come back. I want you to meet the peer extraordinaire. Her name is Nicole Montalego, and she runs the clinic. He said, when I say she runs the clinic, she runs the clinic. And this is her. She could have an office in the back. Most peers are treated as quasi-counselors and have an office. She chooses to work at the front desk. Any guesses as to why? So she can be the first one they see. Yeah, because they're so scared when they're coming in. So I'll read you just a little bit from the book about an exchange I witnessed. In recovery for 7 years, Nicole has a sixth sense for what to say to broken down people approaching her front desk counter for the first time. She gives new patients her direct phone number. When's the last time any of us had a healthcare provider do that? She pulls the tearful ones aside and convinces them to be honest with their provider. So if you've just gone in and you've had this upsetting encounter and you felt judged or you didn't want to tell what was really going on and you're leaving in tears like this, you're gonna talk, you're gonna have a conversation with Nicole. And she'll take you right back to have a truth talk. Then she decides which practitioner they'll see based on whether she thinks they thrive better under Tim's harm reduction approach or the other nurse practitioners whose style is stricter and more tough love. So, and that means that's this idea that every person is different. People experience addiction differently. There are many pathways to recovery. If you don't want to get on buprenorphine, that's okay. But you should know what the data is. So when 36-year-old Julie Steen first approached the clinic counter, she was wearing an oversized pink t-shirt. Nicole noticed her hangdog look and gently asked her, "What are you here for today, honey?" And Julie could only whisper, "It's awful." And Nicole said, "I'm in recovery." She didn't say she was drunk, she just offers. And Julie says, "I'm an IV drug user. I don't work." And Nicole says again, "I'm in recovery myself, and we can put you on a sliding fee scale." And then Julie said, and I watched this, I'm not making this up. Julie said, "I'm homeless. I live in a tent. My children are in another home." And Nicole said, "We want to see you." That is an outlier in American healthcare right there. In the 4 hours I watched her man the front desk, she calmed a psychotic patient who couldn't stop pacing. She counseled an elderly man with dementia who'd just been discharged from the hospital and didn't remember how he'd gotten there. Between patients, she opened a new box of COVID vaccines. After a pharma sales rep dropped off lunch from Olive Garden for the staff, believe it or not, we're still getting pharma rep lunches. Nicole took the leftovers and distributed them to patients in the waiting room. On principle, Tim refuses to eat the pharma-funded freebies, a fact the rest of the staff finds weirdly hippie-ish. So Julie, the woman in the pink shirt, has been sober for 8 months. She's in her late 30s. It's the first time she's been sober since she was 14. I mean, she lived in a tent. She had so much childhood trauma. I couldn't even hear it all. It was so rough. And because Tim went to her where she was, and Nicole treated her like a human being, Tim did the low barrier approach with her. Is her life perfect? No, but she's living with family members now. She has a job. She's been sober. It's pretty remarkable. So this is an example of, later I have a slide that says women get shit done. I'm just saying, it's true. This is Jenny Atwood Lovett. She lost her brother Christopher, lives in Northern Virginia, in 2014. And when she researched, she said, I knew my brother had opioid use disorder and I didn't have any Narcan. How is that possible that I live in a world where people don't know to have Narcan? And so Jenny starts training people. She starts a nonprofit called the Christopher Atwood Foundation. She starts doing mobile harm reduction, just like Michelle and Karen and Tim are. And then she approaches the longtime sheriff, a woman named Stacy Kincaid, that's her third from the left, into letting the harm reduction center come into the jail. Now, every single one of her peers are felons. Guess how many of the deputies wanted them coming in and out of their jail at will. Zero. But they brought in consultants and trainers. And so everybody coming into the Fairfax County Jail gets screened for addiction. They get put on buprenorphine if they want it. And then they get connected with a peer who comes in and out, and they start to work on a recovery plan for when they're getting out. And the moment they get released, their peers pick them up at the jail. So that's that moment when they're most vulnerable, when they're coming out of prison or jail. Her peers pick them up, and they leave with Narcan, buprenorphine prescription, and a plan for where they're gonna go. I mean, that is so rare in the criminal justice system in America. And that took political courage for a sheriff, an elected position, to decide to do things differently. And the deputies are like, what? We're gonna give them buprenorphine in the jail? Some are in here for selling diverted buprenorphine. We're gonna give it to them? Well, that's what the science says is best. And some of them didn't want to do it, and some of them got fired. Now that is courage. So I noticed during COVID that a lot of these peers, this is a peer named Brooke Parker, this is in Charleston, West Virginia. At the height of the nation's worst HIV outbreak in Charleston, West Virginia, Charleston Health Department closed down their one needle exchange because of needle litter and a lot of NIMBYism, and CAVES, which is short for Citizens Against Virtually Everything. And so Brooke's job is to test people for HIV. She's the Ryan White worker from the hospital. She's also a peer, and then to tell them they have it, and then to get them into care during this terrible moment, which is still going on, by the way. And so I spent a day with her, and we were trying to find 3 people. We found one. The problem is a lot of them are living in homeless encampments. And this guy needs her help worse. We never got to the other 2 because everybody had more intensive needs. And this guy had picked out maggots from the abscesses on his feet earlier in the day. He was dope sick, he was crying, he had these weeping sores on his legs. And Brooke sat at his feet in the dirt, put gloves on, and put antibiotic ointment. She couldn't get him to go to the hospital because he had been there the week before, spent 18 hours, and they did nothing for him other than make him feel like a piece of shit. So he wouldn't go. She sent a picture of his wounds to somebody at the hospital. They said, he's got to get on IV antibiotics. He wouldn't go. And while we were there, the cops come up and they put an eviction notice on their encampment on the river. And the helpers really need help. A lot of them are at the ragged edge of capacity. And Brooke herself was thinking of relapsing. She didn't. But a lot of the helpers that I followed in the book, some of them did, not a lot of them. But they're really struggling. We need to scale up peer supports. We need to scale up treatment. At least get it close to match the scale of the crisis. And at a time when this money is starting to come down, this is a mother from Binghamton, New York, named Alexis Blues. She runs a harm reduction group called Truth Bond. And a couple of years ago, she lost her son in 2014. A couple of years ago, she realized that the county was underreporting overdose deaths. So she went on Facebook and she had the mothers report all the deaths that year directly to her. And then she had a little art project in her center. First she had it in her home. And they made tombstones representing each of the loved ones. And they showed up in front of City Hall and they planted a cemetery of all their loved ones. And each, it's made out of corrugated cardboard, goes in the ground, has the birthday, death date, a picture, something about their loved one. And they made the politicians clear the deaths. So she just recently took her cemetery to outside of Albany, New York, where they were deciding what to do with the money. This is Nan Golden, the famous photographer. I tell her story in the book. She's the photographer that had all these actions at the Guggenheim and the Met to get the museums, the world's most prestigious museums, to take down the Sackler name from their wing. And she did it, and Alexis helped her. This is a dad I write about in Dopesick and Raising Lazarus named Ed Bish. He organized a rally in front of the Department of Justice last December because the Sacklers still walk free. They pleaded, companies pleaded twice now to fraudulent marketing. They never, they signed a corporate integrity agreement here in Abingdon in 2007. And then they hired McKinsey to teach them how to get around that corporate integrity agreement. And they doubled down on sales. They turbocharged sales. At one point, McKinsey told them, I know what, we should give CVS and Walgreens a rebate for every person who's overdosed on oxycontin. They didn't do it. Even Purdue knew that was a bad idea. But that's the way they're talking in their shop. And so Ed's goal is that we need indictments. So Purdue wrangles its way into bankruptcy using a loophole. They apply for, file for bankruptcy in the one jurisdiction in White Plains, New York, where a judge there is known to favor what's called a third-party release, which would allow them, in exchange for the company and about half of their wealth, to walk away and get full civil immunity. So these people are not gonna rest. And I was just with the drug czar's office at the White House a couple weeks ago, and I said to him, we had a meeting, I said, what do I tell the parents of the dead? What would you have me tell them about why we have an 87% treatment gap? Why we haven't put anybody save one executive in jail for a crisis that has now affects 7 million people. What would I tell the parents of the dead? He said, tell them to keep pressing. I said, nobody suffered more than the parents of the dead. Nobody. And it's up to them to keep the pressure on for indictments. So this is my last story, and then I'll take questions. It's a happy story. It starts off kind of bad. The first time I went to Mount Airy, North Carolina, they had the second highest overdose rate in the nation at that time. And they had called together a group of church volunteers to give people rides to treatment, because a lot of people live in Surrey County and didn't have a ride to the clinic where they could get their buprenorphine. And so they had a lot of well-meaning church folks. They're gonna do a volunteer transportation network because they only use the church bus on Sunday. So great idea, right? And Michelle, acting on Verba, is brought in to sort of consult. And the meeting is hijacked by a Kiwanis Club president who stands up and says, I think when they overdose, we should let them die and take their organs. The meeting went to hell. First, Michelle stood up and said, do y'all know that song, They Will Know We Are Christians by Our Love? I'm not feeling the love in the room right now. So Surrey County, after these really startling statistics came out a few years ago about their overdose rate, that's Mount Airy, Andy Griffith, a lot of their marketing is around we're wholesome, Mount Airy, we're Mayberry, not really wanting to, put that on the front page of the bigger that no longer exists. So they hired this guy, he's former DEA, former Marine Corps, son of a Marine, former law enforcement, and he comes out of retirement to become Surrey County's opioid response director. His name's Mark Willis. Now that's the Marine Corps motto: improvise, overcome, adapt. And it was really interesting, and that's what I love about long form journalism, is I got to spend 2.5 years watching him just get knocked out. Let him die and take the organs. He first started charting what he was gonna do about the overdose crisis on whiteboards, which were on every wall of his office. And he's in an office almost this big. And that's just one. I mean, there's 8 of them. And he had things he got they started out red, and then when he got the things happen, they would turn green, right? Everything was red for the first year and a half. Even this network of volunteers. But he kept at it, and he kept at it. He got a Bureau of Justice grant. He now has 5 people to drive people to treatment, a vehicle. They have peers stationed in the hospital. They have a post-overdose response team. So anytime somebody overdoses, they get a visit from a peer the next day. He just got a grant for the EMS to get people on buprenorphine temporarily and then connected with a peer. I mean, it's incredible. He's now taken over the entire basement floor of this old courthouse in Surrey County. And he says, because at first he wasn't sure, like, harm reduction, I don't know, like, we're gonna give him needles, we're gonna, and then he started seeing that it was working, treating people differently. He said, what if people take advantage of our transportation network and they expect us to be a concierge service? And then I called him a couple weeks later, he goes, that's great, nobody's overdosed. We'll even stop by CVS and get diapers if somebody wants to. We give some people a ride to work. I was like, yeah, and the world didn't end, right? It's just like Dr. Burton, like putting humanity back in institutions. And not only does the world not end, it gets better. So that's really the message of this book. Gives us just a few final pointments. The treatment needs to get easier to access than the dope. I gave the book to Danny Strong, the showrunner, who wrote and directed a lot of Dope Sick. I mean, it's really his vision. I worked on it, but it's his vision. Every sentence, every camera angle is Danny. And people in Hollywood, don't tell anyone I said this, I know we're being live streamed, don't really read. But he listened to it, and he called me, and in typical Danny fashion, he's so brilliant. He goes, I get it now. Harm reduction is a gateway to MAT. MAT is a gateway to recovery. I was like, dude, I wish you told me that 2 years ago. It took me 400 pages to figure that out. But he got it. So we need to meet both sides where they are. The reason I wrote about Michelle so much is she was the only person in harm reduction who said, we've got to meet law enforcement too. We still live in a world of laws. So she gets to know her prosecutors and her DAs. And then when she has somebody that's in Olive Branch who needs to get their charges dismissed, they're more likely to work through her to help. Call it a pilot. That was an advice of a judge named Wayne Sloan in Lebanon, Tennessee. He works in 4 counties. So it's not a drug court. He calls it a recovery court. It's not an officially sanctioned drug court. But he has a doctor who voluntarily sits in his drug court, and he makes the medical decisions about the buprenorphine. And they reduced overdose deaths by 80%. And they reduced NAS cases by 50%.
Wow.
In 4 counties. The Supreme Court gave him an innovation award, the Supreme Court of the United States. And he says when people are intimidated by trying something new, call it a pilot. And that's a little less intimidating. Call it a pilot, come back 6 months later and show your results. Women get shit done. I'm just saying. And use your social capital for good. I always say, when I'm speaking to, if you know judges, if you know probation officers, tell them about Nikki's program, tell them about Dr. Burton, if you know doctors. So this is what I think Tess meant when she said we need urgent care for the addicted. Seeing it happen a little bit, but not to the scale that it needs to happen. And hopefully, I don't know what's happening here locally in Washington County, but hopefully some discussions will come out of this work and this book and all the great people here in the room today. So thanks so much for having me. Questions?
Do I remember correctly that you were at the 250-year-old Presbyterian Church on, I guess it's still East Main Street, to give a talk about, was it about dope sick?
It was, and Sister Beth Davies came.
Yes.
Yes,
Yes.
yes, good memory. That was through the Friends of the Library, and that's where I did my Abingdon launch of Dope Sick here, yeah.
Somehow I managed to sit beside her. So
She's amazing. So I tell this story at the end of the book about, she runs Addiction Education Center in Pennington Gap, which is in Lee County. And she's represented in the show Dope Sick, and she still works with Dr. Van Zee with her patients, but she's had some health setbacks and she's had to move back to New York, but she's still doing counseling on the phone. And we did a GoFundMe for her counseling center.
that church is celebrating its 250th year anniversary right
Amazing.
now.
Yeah, that's great. Any other questions? Yes.
My question would be simply, when trying to educate people or kind of convince them and get them on board with the harm reduction, is there anything like simple that we could, evidence-based, that we could point them towards, point ourselves towards? Yeah, it's like a cheat sheet, like, hey, I'm gonna sell you on this, and what's my elevator pitch for
Yeah.
harm reduction?
Yeah, well, so I think the 5 times more likely eventually to enter treatment is a really great data point when the largest group of people with OUD don't want to stop using, don't think they can get better. So that plus 3 times more likely to stop using drugs altogether. I mean, that's like, there's so much research for needle exchange. Yeah, some states it's illegal in Pennsylvania still. So it's legal here. At the beginning, the city council and the law enforcement had to sign off on it. But Ginny, the woman I showed you in the picture at the jail, she got the law changed. So the police don't have to sign off on it anymore. And I think, I think of Dr. Cantrell all the time telling the police, just treating them like human beings. And so, like, Michelle says, meet them where they are. Some of the things I've heard that works to like sort of open police's mind to this is a health department director in West Virginia said, they were having a health department was doing the syringe services in this one county. And the director told me, she said, we gave all the police officers in our locality Narcan, and they were shocked. They said, kind of like, you care about us as people too, with real budgets and real concerns. And it was the beginning of a relationship. Like, so I tell this story in the book of Mount Airy where they're basically incarcerating rather than they're burning. And I tell the story of this brand new needle exchange operation called Birches. And they decide, and this is the benefit of a small town, they know the narcotics detective. So they take him out to lunch. And I mean, he's arrested them before, right? These are peers that are taking the detective out to lunch. And they say, Brandon, we're starting this new needle exchange. And Brandon tells me later, he goes, I thought you're giving them needles? He goes, but I get it. They get in their homes, they get to know them, they build trust. So he was kind of an easy sell because he saw that what they were doing wasn't working. But instead of just asking for his support, they said, Brandon, what can we do to help you? And he said, well, we have to give these prevention talks in schools. How would it be if you came to the schools the next time I went and you told your story? These are people in recovery, long-term recovery, both of them. And at the end of the talk, Sonia, who was Mark's first peer in the Improvise Overcome Adapt, she gave him a bunch of her business cards. And she said, how would it be if the next time you have somebody in your cruiser that you think that you've arrested numerous times, which is most of them, why don't you call me instead and we'll get them into treatment? So they started, it was a pilot, it was a baby step. And so it just turned out I had been with this harm reduction group a month or so before, and I had been in a trap house run by this woman named Billy, the former hairdresser. She was giving out clean needles in her trap house. 2 weeks later, she gets busted by bringing heroin from Winston to Mount Airy. And That cop arrests her, Brandon. And he says, Billy, what the hell are we gonna do with you? And she goes, why don't you get me some treatment? She was like 43. She'd never been offered treatment before. She'd been in and out. She goes, I was selling Suboxone in the state prison. I was good at it. Told me all how she did that. And so Billy was like their first test case. Brandon called Sonia, got her to treatment, and Billy has now been sober for 15 months. She said previously when she'd been arrested, she'd either gone to jail or prison, or they had turned her into a confidential informant. This time they did something different. And she's gonna start her peer training class next month. So it's that, like, making relationships, it really is meeting the other side. And any of these folks I know would be happy to talk to you about how they did it, how they made inroads. But it comes down to, like, I mean, I was so frustrated at the beginning. I was like, really, 87% treatment gap? And really, we can't just create a new federal policy? Does this really have to be reinvented in every locality? It does. It does. That's the way healthcare works. I mean, there are certainly some new funding things that could be done differently to incentivize treatment. Yes.
My question is on the funding. I know that the FQHC will treat people without asking what, why, where the ban law violated. My daughter has worked with one in Chicago as a medical provider. Gunshot wounds, they're not asked, they don't have insurance, they're treated. Just on that basis alone, they continue to come. I mean, this is a very minority section of Chicago. If the funding is important and these small volunteer-run individually, I mean, it takes an individual champion. In each case you mentioned, there is a person who has started it. And at some point, you have to sustain.
Yeah.
And you're doing all your networking with law enforcement, et cetera, but the funding has to continue at some point. Is there not a way to have an actual legal connection to the federal government that isn't known to the patients? I mean, what do we not know about, which foreign countries own what companies here in the US? None of us know, but if it could be basically supported, not on the open, obvious level if they're going to a hospital or going to the courthouse, for example. Still in the low, harm reduction, go to them, but the funding comes from an actual established program. What is happening there? Is it?
Well, President Biden is the first president that's ever uttered the phrase harm reduction. And they put a lot of, I think 1.5 million recently, which isn't a lot federally, into harm reduction. They're trying to make inroads. But it's really tricky because of there's a lot of anti-harm reduction politics around it. Even among the parents of the dead, they call them the fentanyl moms. And those are people that want to stop fentanyl from coming across the border, which fair enough. Fentanyl should be stopped from coming across the border. But until we start to shift it from all the money going towards interdiction, and really we're still not addressing the craving for Dopesick. We're not addressing the demand side at the rate.
What's the step that will, short of having to go to Congress, where the congressmen have been bought out by the running the dead end there?
Right. Well, I think the MAD Act would be a great start because it would increase access to treatment quite a bit. And it's this, unfortunately, it's this baby step thing we're stuck with. The harm reductionists have this figured out. I really believe that in my heart. And I do think that the drugs he knows all the data. He knows what's going on. It's just a matter of voting in people who aren't just paid off by the drug companies, unfortunately. Sarah, do you have anything to add to that in terms of galvanizing political will to make sure the money gets spent in the right place?
Well, I think it's continuing to educate and really fighting stigma, because there's still so much stigma around harm reduction and about substance use disorders in general. So I think the more we do education and you know, just promoting that it is not a moral failure, and that, you know, even when I'm doing naloxone training, I still hear, why are you giving them naloxone? You're just enabling them. Well, we're enabling them to breathe and maybe get treatment, is the way I, you know, look at it. It's not enabling them to keep making bad decisions like a lot of people say, but I just think the boots on the ground, the grassroots effort with education, and even our political leaders need to be educated. They do not have the basic understanding they really need to make appropriate decisions, I think, so.
And as well as healthcare leaders.
That's
I mean,
exactly right.
8% of doctors have gotten waivered, and most of them still don't even use their waiver.
That's right.
So it falls on this small cadre of people who are in the trenches, who are working their tails off.
Charitable contributions, what if you got one substantial foundation that had the resources that would embrace your cause? I don't know if that's been an avenue that you've looked at, and each foundation is being asked and asked and asked again, but this is really, I mean, your data, or, you know, money spent versus return on investment, which is what
It's
a lot
pretty
of
good.
these corporations consider. Many of your foundations are corporate backed, but if you could get, perhaps sell it to, maybe a competing pharma. I don't know, whoever makes the drugs to help, you know, maybe there could be some support there. I don't know, but I just think the funding has to be addressed as well as the process and the effort.
There is more funding coming down for harm reduction, and will be, but it's gonna be like everything else in America. Some states are gonna have it figured out and others aren't, and it's gonna be usurped by incarceration first. That's why it's so important for people to know this information.
And I'm really hopeful with the Opioid Abatement Authority in Virginia that we will be doing the right thing and getting the funding to where it needs to go. And I'm really looking forward to see how we move that forward. We have a phenomenal executive director. Senator Pillion is a huge champion of, and he knows where the money needs to go. So I'm very hopeful that that's going to make a big difference.
Is he anti-MAT though?
No,
He's not? Okay.
not at all.
Okay. Yes.
So I know there was a recent law passed of, like, you're in a situation where you are around someone that ODs and, you call the authorities to come and help you and help that person. I know you can't leave the scene or the situation, but I know personally a lot of people are afraid of that.
Yeah.
Like, a lot of people are around that situation and it happens and they're terrified because of what's sitting out or what they've been doing or whatever. And I was wondering, like, how it's progressing, and also for Narcan administration, what is going on to spread the word and education about that even further than just hypnosis. It's life-saving. It's crazy the amount of situations that are in this area that it happens every day.
Can you get Narcan at the health department here?
In Smith County, yes.
You can get it in every health department.
But I know there's a needle exchange in Marion, so.
Well, there is. That's good.
Yes.
And then I know there was a Good Samaritan law that came out in like, what, 17 or something, but it was kind of flawed, like there was still a way
There's
police
still
could get
gaps
you.
in it, that's
I
for
think
sure.
Jenny got that law rewritten to be better, but I don't know the latest on that. Do you know, Sarah?
I mean, it's my understanding with the safe reporting part of the law you're talking about, that it is working. We're seeing a lot more people that are administering the naloxone and not just leaving, they're staying there with them, than we used to. So, I mean, it's still obviously a problem because people don't know that law enforcement is going to support you giving them the naloxone and staying there until they breathe again and be.
Yeah,
on that
giving
one.
rest to people.
Right.
Yes.
First I have an observation and then a question, but you talked about the, what about people taking advantage? And I ran into that, I work at the food bank here, and every now and then you'll get a funder or a donor who will say, well, how do you know that people need the food? And, at first it took me a while, I was stumped how to answer that. And then one day I was talking with a friend who is very well situated, and they talked about all the free travel they do. And I asked how, gee, how do you do those points? Like, well, I have like 30 credit cards. Your spouse can get one, you can get one, and every time you get one, you get bonus points, and then you can swap them for this. And just this whole master scheme that it just dawned on me like a light bulb. Every economic level takes advantage. Can we get around paying less tax? Can we do this? Everybody takes advantage of this, a loophole. So why should this be any different? And it doesn't mean we shouldn't do it.
But when it's poor people, like,
It's
you
so
know,
different.
I get in these arguments. I have a friend who's a judge in Stewart, who says, Beth, if I put my probationers on buprenorphine or allowed them to be on buprenorphine, they would sell it in order to buy meth. And I said, that's observation bias. You were seeing the ones that would do that, but you're not seeing the people who are getting their kids back and their families back. And I don't know, I didn't change his mind, but.
I did have a question. Virginia, you have to have a master's degree in counseling to really get involved with any official system and work. I could qualify as being a peer recovery specialist, which I would like to do, but how can a person plan you as their rate of help as a volunteer? Is there a mechanism for that, or who would you talk to?
I would talk to the local harm reduction group. So there's Virginia Harm Reduction Coalition. It's based in Roanoke. You said you have a harm reduction group in Marion?
Through the Mount Rogers Health District. Yes.
Okay, that's fantastic. Do you have one in Abingdon?
No, it's just in Smith County right now.
Okay, so maybe you could start one.
Okay.
They do amazing stuff. I mean, it's more than just clean needles. It's help with jobs, it's referrals to treatment, it's food, it's all kinds of things. And I call the peer recovery specialists my rowdy angels. They're really in the trenches, and nobody can talk to a person in use like they can. And like I was telling you about Sonia, Mark's first peer, she will go meet people in the hospital after they've overdosed, and she'll be like, I've been here too. And then she's with them. Does it work with everyone the first time? No, but she's had a lot of wins. That's a lot better than what was happening or not happening before.
I just want to say, we do a drug and alcohol ministry over in Russell County. Brandy originally was going to go to class for peer recovery, and one of the gentlemen that was teaching the class said, I know what you all do. You go in and you meet these people. We went into the Laurels, if you know where it is.
Yeah.
On it for 14 years. If you just go in and sit with people, give them 10 minutes and love on them. You'd be amazed what you can see. We've probably given our personal phone numbers out to thousands of people. I know we have. We are about to get, we know we've already gotten about $260,000 in Russell County from the settlements. And you gave me an idea when you were talking about the tombstones. I thought, what an idea. Because we went to the Board of Supervisors the other night and said, what are you going to do with this money? Do not throw this away. Don't buy a park bench. Don't buy a
Quick cop car.
We want it as a prevention thing to reach the kids, the ones coming up even. We brought Mark Marrow, who is a ex-wrestler, into all the county high schools about 2-3 weeks ago. And the stories that he got, because he opens up his page for Instagram for any kid to reply, you'd be amazed what kids heard in 20-30 minutes and the stories they came back to him with. Kids are craving to have people reach out to them. We don't have, if you're not trained, just be that volunteer that just goes up and gives a hug, because our kids are desperately reaching out. But that just gave me an idea of something we could take the Board of Supervisors, because I know we've had our share of deaths over there, and say, this
And
is
get them
what,
organized,
look at
get
this.
the parents organized.
Yes.
Yeah, I mean,
So I
again,
appreciate
should it be
that.
the parents? No, but
No.
who else is it gonna be? And I'm at that food pantry food bank event that we had, you had a food pantry
Yeah.
out of Galax.
Yeah.
Will you tell the story of what they're doing? I think it's incredible.
Yeah, well, essentially, they were providing food and realized that so many of the people that were coming up to pick up food were showing signs of addiction. And so this food bank person developed an outreach program and started having meetings on a regular basis at the food bank for people to attend and just get community support, be with each other and help each other. And you may know more of what she's done, but
Well, she would describe her mother sitting there and a person in active use, like she was literally spoon feeding her at the table. And then, then the trust starts to build.
was feeding people. It's a
Literally
great
feeding.
gift, because
Do you remember her name and the name of the organization?
now it's escaping me. I
Yeah.
emailed with her and I'll forget it.
Yeah.
I want to go down and see what she's
Yeah.
doing.
Galax.
But they would have 60 people a night at a meeting. I mean, it wasn't just a few people showing up. But they just meet them wherever they are and try to help them take the next big step.
Did you have a question?
Yeah, so I have kind of wrestled with the Narcan thing, just as an everyday citizen, and wondering the medical ethics of it. So putting myself in this situation, if I were to see someone showing signs of OD, but I don't necessarily feel confident to be able to assess that myself. And then to feel confident to even be able to administer Narcan. And so I just wonder around giving Narcan to whole communities, do we even know how to use it? And where are what is the training there? And
It's taught before you give it.
There's
Yeah.
a training.
Have you not been through the Revive training in Virginia?
I have not.
Okay, well, you need
Well,
to.
really,
I didn't
all of
know
us
that
in
was
this room
even
right
good.
now should have Narcan with us. I mean, how many of you have it in your pocket right now?
In my car.
Or in
It's
your
in my car.
purse?
Do you?
But all of us should
So
be
one.
carrying this. We know libraries, we know gas stations, we know restaurants, we are finding people that have overdosed there, and all of us would have the opportunity to administer it and save a life. Naloxone is just, it's so life affirming and life saving that you can't go wrong by giving it to someone. Even if they've had a heart attack or there's something else wrong and you think it's an overdose, you're not gonna hurt them by giving it to them. So that's why, as a lay person, if you're not medically trained, everyone should carry it. The Surgeon General came out, I guess it's 5 years ago, and said, we need everyone to carry it. All of us. And even yet, when I'm in front of healthcare providers, most of them still don't have it. So we have such a long way to go to make sure everyone carries that. Because we're all gonna encounter it somewhere, or we might, and we wanna always be prepared.
But just yesterday, there was a health fair in front of Sinking Springs Presbyterian Church. 37 people walked away with Narcan.
Great. And were they trained too?
Yes, we trained them.
It
right
takes
there on
like
the
5
spot.
minutes, right?
Takes like 5 minutes.
Yeah.
Okay, so where do you get it?
You go to the health department,
Health department?
the Department of Behavioral, like community service boards also have it for free, and you can walk into any pharmacy, call to make sure they have it, but you can walk into any pharmacy and get it without a prescription. It would be on your insurance then.
And is it ASAP in this area? If
Yes.
you contact them and you have a group, they will come out and train you and give you the Narcan.
Yeah, just to kind of pick up on what Christina said, I'm Kevin Campbell, and I'm the pastor of Sinking Spring.
Oh, great.
And we hosted the local ASAC. Christina was there with the Medical Reserve Corps. I required everyone on my staff yesterday to be trained. And the reason is you can no longer assume, even in churches, that somebody is not, that does not tell them that there's not a crisis. And we need to be trained and prepared. In fact, last winter at 6:30 in the morning when I pulled up to work, there were 2 people in a car that were clearly homeless. They had accessed our blessing box in the back. I knocked on the window to make sure they were okay. We're in crisis. And that happened in our back parking lot.
And did you know who to call in order to get them help?
Yep, we did, and so, we were excited about 37 people yesterday. I mean, we would have loved to have had a lot more, but I think Narcan is essential. I just wanted to echo that.
Yeah, let's do one last question, and then I'm happy to take individuals like when I'm signing to.
I just thought this was something really cool. My sister recently moved to Italy and had like a minor procedure. They gave her Narcan with the opiate in training.
Yeah.
Oh,
Like
amazing.
at the same time.
Yeah, yeah.
So I just thought that was really.
I mean, that is kind of a best practice, isn't it? If you're a doctor and you're giving somebody a prescription, to also give them a prescription for Narcan. I mean, I have it on both floors of my house, because you don't know who's gonna come to your house. At our book launch in Roanoke, Virginia Harm Reduction Coalition came, and they had a table set up. Well, in Roanoke, everybody shows up for everything an hour early. They just do, we're polite that way. And so like 45 minutes till, I said, hey guys, they're doing a Narcan training in the back. Takes 5 minutes. I really think it's important for everybody to have them at their home, because you don't know who's coming into your home. You might get prescribed an opioid and take it and then forgot you took it and take it again. I mean, you just don't know. And so like 1 or 2 people came over, and then they were like, yo, it's not bad. It's easy, it's great. And then by the end of the night, like a third of the group had done the training and signed up to be volunteers for the Harm Reduction Coalition.
You should do it at all your speakings before.
I do a lot, I just forgot. I personally should do it. We have done it though, that's a great idea. I'll start bringing that up. Well, thank you so much, appreciate it.
Every time Beth finishes a talk, she gets kind of bobbed here.